Welcome to the Iron Prescription podcast with your hosts, Doctors Lynette and Stuart. We're both GPs and we're both personal trainers, though we do both jobs in very different ways. We chat about the best things you can do for your health and fitness, and along the way, help you to avoid wasting time on the things that really aren't. Thanks for listening. In today's episode, Stuart and I are joined by a very good friend of mine, Dr. Samantha Lewis, a really experienced clinical psychologist who now specialises in neurodiversity assessments in adults. She'll introduce herself and we'll talk at length about all things ADHD related. I suspect you're going to learn a thing or two. I know I did. Welcome to the podcast, Sam. We wanted to get you on to talk about your world of expertise in the field of adult ADHD. So in a sec, I'll ask you just to introduce yourself and explain your background and how come it is that you know so much about this. But the reason we thought it would be a useful topic to discuss is because there's a lot of chatter about it now. It's almost becoming quite mainstream, would you say, for people to acknowledge ADHD, to seek a diagnosis, and in the general conversation. And there's a lot of misconceptions, I would say, that I think you're perfectly placed to shed some light on and for people to get value from, because not everybody's got access to an experienced clinical psychologist who knows this stuff like the back of their hand. So explain your background and how you've entered into this world and how you know so much about it.
Okay, so yeah, I'm a clinical psychologist and I've worked in adult ADHD and autism for 20 years. So it feels like it's been my entire career, and it hasn't, but it's been the vast majority of it. Yeah, for the last 20 years, I've focused very much in the specialism of autism and ADHD, so neurodevelopmental diagnoses. So I think it's really interesting because then in those 20 years, I've seen an enormous shift from people not thinking about ADHD in adults, which is why we set our service up, because children were getting diagnosed and then they were becoming adults. And at the point where I started, it was believed that people grow out of ADHD. They then get relabelled as having a personality disorder a few years later, inevitably. But there were no adult services because adult ADHD wasn't considered to be relevant. And then actually they quickly realised that wasn't the case. So yeah, it's shifted hugely in those 20 years from it doesn't exist, it's not there, it doesn't happen to adults, children grow out of it, to where we are now, where, as you say, it's very mainstream with lots of people really thinking about whether it relates to them and helps them to explain the way they function. And yes, become very mainstream and part of the ordinary conversation, I think, in lots of different ways. So yeah, I've spent the last 20 years doing diagnostic assessments with adults, as well as seeing people for follow-up sessions to help them make sense of the diagnosis, help it to understand who they are and the way they do things, and hopefully put strategies in place to make life a little bit easier.
So for people who aren't close to it and it doesn't come into their life, could you succinctly say what it is? Because there will be people that just go, oh, they're just disorganised, or it's people that just can't sit still. And it's not that, but I don't do what you do. So you're better placed to explain what it is for people who it hasn't touched their lives, because there are those people out there.
Yeah, absolutely. It's a neurodevelopmental diagnosis. So what that means is neuro relating to the brain, developmental meaning it's always been there. It's been there as you've developed throughout your life. It's not a diagnosis, or it's not a condition that you get later in life. You will have always had it, but probably didn't know that you had it. And it's part of the neurodevelopmental set of diagnoses that includes autism, dyslexia, dyspraxia, and ADHD is one of those as well. And in terms of ADHD, it's mainly issues and differences around attention, concentration, organisation, impulsivity, and hyperactivity. So there are these kind of key areas that people will experience differences in. And I guess where the disorder part comes in of the title is when those differences are having a significant negative impact on somebody's life and really affecting their ability to get on and do the things that they want to do and need to do. We could debate the title ADHD because I think it's really unhelpful. I don't necessarily see it as a disorder. And this idea that attention deficit means you just cannot pay attention is not actually true. It's about problems regulating attention. So people with ADHD really struggle to focus and to concentrate, usually on mundane everyday tasks that they've got to do, but they will also have areas of their life or things that they can hyper focus on and they're completely locked in and zoned into. And then actually the issue comes is they can't unfocus. So it's not really a problem of inattention, it's a problem of regulating your attention, moderating it when you need to moderate it for all those things that require a certain amount of attention, not huge amounts of attention, but equally you can't not be paying attention to it at all. So all those everyday tasks we have to attend to now, emails, household chores, text messages, WhatsApp groups, all of that kind of stuff is incredibly difficult if you struggle to regulate your attention.
And given that when you would have started moving into this field from other areas of psychology, the internet existed. We're not going back to black and white days, are we? But how significant do you think all of that is to what we're seeing now?
In terms of people recognising that they may have ADHD, that kind of...
Yeah, in terms of... So I'm thinking of the narrative that's out there. Like many people, you pick this up in comments online, on Instagram posts, on Facebook in particular. And the kind of things that get bandied around are, oh, we're all distracted because we've all got notifications going off. But you would have been assessing people before WhatsApp was invented, even probably before Facebook was invented. So what kind of things do you remember seeing then that would have marked people out?
Yeah, I think it's the same challenges and it's the same issues. And I think that's one of the kind of difficulties around ADHD is everybody struggles with some of these things sometimes. So we all get bored and we don't overly like being bored. We all get distracted. There's always that kind of thing we need to get done that we get done at the deadline. So I think one of the kind of challenges is that we can all recognise parts of ADHD in ourselves, but in order to meet that diagnostic threshold to have ADHD, these things are persistent, they're consistent, they're in all areas of your life, and they have a significant kind of impact on your day-to-day functioning. So, you know, we'd just be they'd be talking about it in different ways. But I do think the modern world is less and less well designed for somebody with ADHD. If we look back a couple of generations ago, if you struggled to focus and couldn't sit still in lessons, you left school at 12. You went and did a very kind of manual job where you didn't have to fill in lots of forms and paperwork and do many invoices. People would just pay you cash in hand and it was all done. I think there was more variety in terms of how you could live your life if you kind of struggled to moderate your attention, whereas now I don't know anyone who does any job where they don't have to fill in copious amounts of paperwork and respond to messages and keep on top of things and do all of those kind of bits.
Do you not think... Hi, Sam. I'm Stuart. Lynette didn't introduce.
Oh, sorry.
That's her autistic traits coming out there. But we'll talk about that later, if that's okay. If I could speak to you on the side clinically about Lynette. So, however, you know, we've got this, you know, my son's got ADHD, autism and PDA. And I can absolutely assure you that he has ADHD, autism and PDA because as an experienced father of having two children before him, he is completely different and the difference is huge. However, I see a lot of people who see something on TikTok or Instagram and it says, do you have ADHD? Take this test today and it will tell you if you have ADHD. And of course, they do this and then they fall into this trap of going, actually, because I can't be bothered on a Monday, that's ADHD. And we've got a society that's definitely far more structured for people and supportive who've got autism or ADHD. But we've also got this huge surge of people saying, I've got ADHD. And of course, my thoughts are that rather than ADHD being a thing or autism being a thing, it's a bell-shaped distribution curve. We've all got certain traits, but the people that have got a true diagnosis lay at one end of that bell-shaped distribution, and the rest of us are in the same distribution. Somebody who's got ADHD or autism, they're not a different species or anything like that, but they've got extreme levels of areas in their life that is affected by this bit that's that way inclined. And however, there are huge positives about being at this end of the spectrum as well as being negatives. And just what your thought was about have we over-egged it a lot in current practice, and are we looking for something that actually we just accept that's part of life? Those traits are part of life.
Yeah, sure. Okay. I think part of what you're describing is how generally society is now choosing to understand everything, be that kind of menopause, trauma, mental health, back pain. And it's interesting that people often pick up on certain areas, and ADHD seems to be one of those that then gets particularly, oh gosh, everybody thinks they've got ADHD. When I think this is more where we're at as a society in terms of how we want to try and understand things and categorise them. In terms of kind of ADHD, I guess often the way I think about it is lots of people have an ADHD brain, and lots of people have this kind of difference in regulation. They get hyper-focused, they struggle to pay attention to other things. But the bit that then marks that out as to whether you will get that clinical diagnosis of a disorder is the impairment. And there'll be lots of people who connect with stuff online. If they connect with it online, then great. If they go, yeah, that is really how I work. But it's about the level of impairment. And that's where, as a clinician, that's a really important part of the assessment process of somebody meeting the clinical diagnosis. And if you like, that's the disorder bit. If we want to see where is a disorder part of it, then it's about the level of impairment, that actually there's a consistent story and narrative of people struggling at school, not getting the grades that they expected to get, making decisions that they wish they hadn't made, going from job to job, and it not being about their intellectual ability or their desire to want to do it, but that they cannot sustain the things they need to do about it. It's about people wanting to manage their house but getting into debt because they forgot to pay the parking bills. And it's a kind of persistent, consistent sort of story of problems with attention and concentration.
And I like when you said, because obviously there are a lot of people out there, because the other issue that we've got at the moment in medicine is huge numbers of people being labelled with personality disorders. You made reference to that earlier, that people were being misdiagnosed as having a personality disorder in adulthood when actually it was ADHD. And the characteristics you've just described there, being able to hold down a job, disorganised life, making decisions that they then subsequently regret, and that may be in a social setting or in relationships. That's very close to what DSM says about a borderline personality disorder. Mm-hmm. So how do you differentiate ADHD from a borderline personality disorder?
That's a great question. I think that's where it comes down to doing very comprehensive, very clinically well-informed assessments. And that's why these diagnoses cannot be done quickly and should not be done quickly, because absolutely it's about teasing these things out. The other sort of diagnosis that often gets given to people who it turns out it's ADHD is bipolar disorder. But people will come and say, but I don't get depressed. I get really energised, and people see that I'm manic, and I can understand why they'd see that, but I don't get low in mood. That's not who I am. And it's about pulling those apart and seeing what are the mechanisms at play that are leading to that person to keep leaving their job. Mm-hmm. Is it related to sense of self and relationship challenges that we might understand more within a kind of personality framework? Or is it about inattention, boredom, restlessness, making mistakes, which gets you into trouble with your manager? That then leaves kind of people to leave. So I think it's trying to understand and listen to the patient, listen to the client. What are they telling you, and how are they understanding it? And then how together can you work that through and think about what's the best, often the word I use is framework, what's the best framework to help explain where somebody's at? Is it more around long-standing attention concentration differences? Is it more around kind of relationship kind of challenges? And trying to unpick it in that kind of way.
Okay. So from what you're just saying there, so what you're telling me is you can't actually do a 15-minute test on Instagram and have a diagnosis.
What?
Shock horror.
Of course I'm going to say that, because that's my job, is just in diagnostic assessments. I think people can do those short things to give them a sense as to whether you think, is this relevant for me? Do I connect with some of this? Does some of this resonate? And we all do that, don't we? If we're struggling with something, it might be knee pain, we're going to find something that would maybe helps us to try and point us in the right direction. And I don't have a problem with people going, I never really thought about, maybe that's relevant to me. And if that helps people to understand a little bit about some of the things that they do differently to their peers, then I don't think that's a bad thing. As we all know with the internet, in any area that we work, we don't want then the internet become the diagnostician, because it's much more kind of complicated and complex than that. But if it highlights some area to somebody that they hadn't really thought was relevant to them, or they hadn't considered it in that way, then I don't necessarily have a problem with that. And I think one of the things I do like about it being very relevant and in the public domain is it's helping to remove some of the shame around it, because there's a lot of shame for people who do have ADHD because they've spent their whole lives trying to mask and hide the chaos of their house or their kind of disastrous job history or their kind of academic record or whatever it is, their kind of hobby graveyard. They've tried every sport, bought every kind of piece of equipment for it and then got bored and moved on. And all of that is often really shaming for people. If we're moving towards a space where people feel less ashamed about that and more just able to recognise it's part of who they are, then I don't necessarily think that's a bad thing.
Yeah, it reminded me of what we touched on in the previous podcast, Stuart, in health anxiety, when we were talking about the risks of using Google to answer your symptoms and how it can't filter very well. And whilst it can be a useful resource if you have a diagnosis, it can be a great sense of support and open doors to more information, and people can find that really useful. But it isn't skilled at diagnosis. And I would say people on TikTok, I would accuse them of the same lack of skill at diagnosing things. And I think people sometimes have a tendency to, and we're seeing this with lots of conditions, so they take their own experience and assume everybody else's must be similar, and then where things overlap go, oh, you must have it because that's what the clinician said to me, etc. And people just take those bits and run with it. So big caution there to people. But I think you're right. I think it can be helpful if taken as it is, as a marker, as a kind of finger in the air to get a sense of whether or not there's something to explore. I think as doctors, we've struggled, as GPs, should I say, we perhaps struggled a bit with this, because there will be those patients, and there are those patients who have done that initial test and have already made their mind up about what they've got, want to skip the diagnostic part and access medication. This is particularly relevant with ADHD. And they've closed the door on any kind of exploration and negotiation. Sam, have you met many people like that who've been quite resistant to the exploration because of their own self-diagnosis?
Yeah, but I guess that's where that full assessment is really important, and you can't access medication until an experienced clinician has given you that diagnosis. And it's a very long wait. It's either very expensive if you're paying for it privately, or it's a very long wait if you're on the NHS. So I guess by the time I've seen people, you're in for the long haul. It's not just a case of, oh, I've just decided that's me and I'm going to sit and wait for this. They are the people who really do need that diagnostic assessment, and the vast majority of them do meet that diagnostic threshold. What, as you say, at the GP level, when people are first coming, we're going, oh, I saw this thing and this makes me think about. It's at that level I think the real challenge is, because I do my comprehensive assessment. It involves informants, it involves school reports, it involves a very thorough assessment, and then I can be pretty clear as to whether somebody does or doesn't have ADHD.
It's interesting what you say there, Lynette, about the medication and accessing medication. Obviously, the elephant in the room is talking about that medication and what actually medication is for ADHD. And the mainstay of medication still within ADHD is stimulants. That for us would cause hyperstimulation, but for somebody with ADHD, help them to be able to regulate the chaos that they have. So you're talking about really, and those stimulants are very powerful stimulants, methylphenidate being one of them, and that they are a drug of abuse. And they are a drug of abuse in America, one of the highest drugs of abuse in students, university students, and the financial markets, because they cause hyper focus that allows you to revise and take on information and also not sleep for long periods of time, which is ideal if you're either looking at huge amounts of data, as in the financial markets, and looking for anomalies or tracking numbers, or you're revising for an exam. So I was just wondering what you think about that, and do you think that there's an element of people trying to manipulate the system to obtain those drugs for the wrong reasons?
I would say not, and I'm sure there are people out there, but the people I see it's what they need to be able to kind of function and to be able to get through. They're coming with a story of failing everything, even though they're really academically capable of being at university. So it's about levelling the playing field so that then they can get things done in the way that other people can. I would imagine there are other ways, if you want to manipulate the system, to probably access stimulants rather than sit on an NHS waiting list for 8 years and then wait for another kind of year to get medication and go through the mental health checks. They're not generally the people we're seeing, but I think it's difficult because there clearly are those people there, but that it's really important that doesn't detract from how helpful stimulants can be alongside other kind of things. And obviously it's the main kind of first line of treatment, but actually what's just as important is people understanding the brain they have, making sense of why they struggle to focus in some things and why they can hyperfocus in others, accepting their brain, accepting who they are, and working with it and leaning into the kind of way that they need to for their attention and concentration, and moving on to a compassionate way of understanding themselves. So that, alongside medication, alongside strategies, can be incredibly beneficial for people.
What's your viewpoint on that? So my experience is, as a father, is that actually a lot of the negativity that's so surrounded around ADHD can be changed to a positive, and a lot of the things that my son does, we actually use the benefits of his diagnosis to achieve what his peers would like to achieve but are unable to achieve because they don't have the way that his brain works with ADHD, for example. And a lot of people go, "You do what with a child with ADHD? Oh my God, are you mad, man?" So he does a lot of motocross and a lot of sports, but he's incredibly, that's one of the areas where he is incredibly focused, but also has this huge advantage where he'll see an opportunity, a gap, and go for it, or he'll go for a jump that other people would back off from. And I just wondered how you see that, and do you see that actually society is saying you don't fit into society, but actually the skills you've got really should be valued by society, as opposed to going, actually you just don't fit in?
Absolutely. And to have an ADHD brain is just to have an ADHD brain. And there are fantastic strengths that come along with it. There are things that are okay. And then there are areas that people really struggle with. So absolutely, there are lots of people who lean into their kind of ADHD brain. And they generally are the entrepreneurs. They are the sports people. There's so many kind of comedians getting diagnosed at the moment. And again, I wonder, are they being diagnosed now because they have to do lots of admin and kind of social media interviews, whereas a generation ago you just went on stage, did your kind of comedic stuff and came off. So yeah, absolutely, there's fantastic benefits and strengths of an ADHD brain, and we need neurodiversity in our kind of world. It's really important. But I think it's interesting, it's at a societal level, but also at an individual level, the shame that people often feel. Because if they've not been harnessed in the way you're talking about, actually, I can see that you love motocross, let's push into that, let's do those things. If you've grown up in an environment, whether that be kind of family or people around you or your peers or teachers just going, just sit still, just be quiet, just slow down. No, you can't go outside. Pack it in, be like your siblings or be like your kind of other kids in the class. Come and sit at the front. You're just too much. You're too difficult. Then people have lost sight of all their strengths and benefits, and they're just very focused on all the things that they don't do well. And as we all know, when we are focused on the things we don't do well, we lose sight of our strengths and our abilities. I think absolutely that change is incredibly important at every level, from an individual level to a society level. And I do think the world isn't overly designed for people with ADHD in lots of ways. And one of the main theories about ADHD is people with ADHD are the hunters. And when we needed hunters, absolutely perfect. That's exactly what you need. We don't need hunters in our current world. We're all supposed to just sit at our computers and tap away and tolerate being still. And that's really hard if that's not how your brain is wired and what you need it for.
Absolutely.
Are there any particular professions or big areas that you are seeing people from? I know you've done assessments for different organisations, for example. If you zoom out on all of your experience, do you think there are certain sectors where people have gone into with this and have either excelled or else really struggled? You've touched a little bit, I guess, as we move more towards being knowledge workers generally. It's getting harder and harder. But I'm just interested in perhaps, I mean, comedy's a great example, maybe the sports world, which I'm sure we'll come on to discuss, but just your reflections really on 20 years of seeing all different people with this.
Yeah, there was some research done, and I think one of the main areas that people go into is business and generally entrepreneurship. So that can work really well for people. Yeah, lots of kind of sports industries and creative industries, so dancers, so where you're using your kind of body and where you're able to move around a lot. I think again in other kind of organisations, so police officers, I think that in lots of ways that works really well for somebody. And lots of people who are very creative would say they've got quite an ADHD kind of brain in terms of ideas and creativity coming. I guess I've seen it clinically, individually across all kind of spectres, because I guess I'm seeing the people who are really struggling. So they're maybe not in the job that's the best fit for them. So there'll be loads of people out there who would tick that threshold for the kind of different aspects of ADHD, but we're not seeing them because they're channeling it in a very positive way. So they're not generally going to be the people that I see day to day.
Yeah, that's a whole conversation itself. People ending up in a particular career. We see a lot of medical students, don't we, that end up drifting into medicine because that's the expectation within the family. It's just a really bad fit, and it just creates misery in those individuals. And eventually, what I've noticed is that they often go and start businesses and end up perhaps where they should have been. But yeah, I do think you're right. There's probably some career paths that some people could take, and it just works. It just works. And like you say, suddenly there's an admin burden. I was reminded of a guy, not that he had ADHD, I think he probably had severe dyslexia. I saw him some years ago, and he was a mechanic, very good mechanic by all accounts. But for some reason, he'd been moved on to kind of light duties. I think he'd put his back out or something. So they'd moved him on to reception, and he was really struggling and getting quite panicky at the thought of having to answer the phone, because he just really struggled to be able to get the messages down in the right time and hold it all in his head. And of course, he comes to me as a 50-year-old going, "Oh, what could this be?" Somebody suggested I might be dyslexic. And I just thought it was really interesting. I couldn't really help him because dyslexia is education based. It's not health. But how he just, he'd been fine and he'd done really well in his chosen career, but then a slight deviation just brought to light this major disability, really.
Yeah, absolutely. And it's often when people are in jobs and you get promoted. So when you're first in a job, you might be, depending on the area, and you might be doing lots of different stuff, going and sitting with lots of different people and learning lots of different skills. And then you maybe get promoted and the job is more office based, or you're having to manage other people, or you're having to deal with the finances, or you end up doing the accounts, which you weren't doing when you were junior. So I think again, it's when I'm talking to people about their kind of career and their journey in the world of employment, which aspects did they thrive in? What was good about that job? What was difficult about that job? But what can also make a massive difference is the manager. So generally people with ADHD really need clear structure. They need variety, they need flexibility, but they need structure, which is very different to routine. And if you've got a manager who's very good at giving you freedom, but also telling you've got to get that in for that point on a Monday morning, that works brilliantly for people. So people say, I did my job brilliantly, and then my manager changed. And this manager was so lovely, she just let me have free rein, and I just could no longer get the things done because I wasn't having that urgent deadline and somebody keeping me on track. A workplace can change, your role in that workplace can change, and who you're working around can change. Or if you work with a colleague who says, actually, I love all that admin stuff, I'll do that. You go and do the client-facing stuff because I don't really like that part of it. Great, you're both playing to your strengths. Then that person leaves, or they've run out of money, so they've decided there's only one role, and suddenly you've got to do it all. And then it's incredibly difficult because you're having to do things that you just cannot get your brain to do.
I'll just pick up on a point there that you just picked up, that you just talked about. There's a huge difference between structure and routine, but so many people put them in the same bracket together, and they are completely different. Routine is basically boring, and especially boring for somebody who's got ADHD, but structure is so important. And I find when I've got clients that I'm working with that have ADHD or neurodiversity for whatever, they definitely need structure, and they're so brilliant to work with because they will give you 110% in that structure, but you have to give them the freedom to be able to work within a boundary. It's not a didactic, right, we will do this, we will do this, we will do this. There has to be that change in the way we're going to do something, and an acceptance that I need to flex to accommodate them. But like I say, they will give you 110%.
Yeah. Absolutely. And that's then somebody, really working with their ADHD, and you working with their ADHD, and meaning that person is going to get the best out of whatever it is, whatever activity they're pursuing. But you can also see how quite quickly it goes wrong if somebody sets you a routine and then you can't stick with it. So then they're seen as a kind of client who doesn't care or isn't motivated or can't be bothered, and then it's all quite shaming, so then they leave, and it just can kind of go a very different way when there isn't that understanding and recognition. Absolutely.
Yeah, and I do find though that there is this quick reward cycle that people who are on this side of the spectrum, where they need a quick reward. Long-term goals, you've got to really have something that works immediately, medium and long-term, but don't really focus on the long-term, because you'll lose them at that point. They need something that's going to be rewarding within a session. So when I'm working with somebody, whether it be in the gym or out on the hill or on mountain bikes or with motocross, they need to get something back. They need that immediate feedback of positivity to take them through to the next goal.
Yeah. Absolutely. And that's where I think then working with, whether it be a coach or a family member or whoever it is, about somebody else almost holding the long-term goal in mind, because generally we start with a long-term goal and then it just seems so far away for somebody with ADHD, they just forget it, give up. And it's really hard. So it's how do they then have these small kind of goals that kind of keep that level of engagement up for them? And that's tough.
It is. It's really tough as a coach to find those small, because they're so important to maintain that. And but it's so rewarding when you do find them.
Yeah.
The other thing that I was going to say is, especially with adults who say, actually, I'm going to stop my medication because I feel like that it's suppressing me as a person. And I definitely know this with my son. He's in special education, and he would be at the very high end of the spectrum, I would say. But he will say to me, is it okay if I come off my meds for the weekend? And we will just have an absolutely wild weekend. It's absolutely wild. And then come the Monday, he's saying, can I have a tablet, please? But I think that's important, though, to recognise that actually sometimes I feel like we're medicating people for society, and actually we should give them a choice.
Yeah, and it's really interesting, and my kind of sense, obviously I'm not a prescriber, is there's quite a variety of views about whether you need to take ADHD medication every single day. And some people will say that's important and feel that it builds up certain kind of network paths in the brain. Some people have that view. And then I guess anybody who generally works with young people, works with students particularly, know that people don't want to take it on days when they're on holiday or it's weekends or where they don't need to focus. And so they tend to be much more flexible in their prescribing and conversations with people. If we think about, the analogy I often use with clients is about, if we think about our brain as an orchestra, if somebody with ADHD has got all the different instruments, they've got all the different skills and ability, but in ADHD, the bit that's not working properly is the conductor, the kind of that prefrontal cortex has nodded off and gone to sleep in the corner. So ADHD medication wakes that conductor up and means that people can focus and plan and organise and get things done during that day. But often people don't like that about, or what they do like about themselves is the fact they are quite sporadic, and they will suddenly do something quite spontaneous, and they will be funny, and they will say something out loud when other people wouldn't. And so it's about actually that bit then also gets a little bit more sensible when you're on medication, because that's dampened down and you're not being your usual impulsive, fun self. So I think when people do say it sedates them, in that sense, it's that kind of personality part of them. And it's great to love those things about yourself, and you don't want to then squash those down. So I completely understand, and I guess most people I see want to take it on the days when they need to take it, when their environment is not conducive to who they are as a person, but they've got to get through it. But they also don't want to take it, and you hope you're around friends and family and people who love you for your chaotic, impulsive, loud, exuberant self. that then you can be your true self rather than feeling you need to manage all of that by medication.
That reminds me a lot of, you've heard, I'm sure Stephen Fry has said the same thing about his treatment for his bipolar. I might be quoting the wrong person, but a lot of people with bipolar they miss the highs because, especially if they're very creative in those highs, sometimes we'll stop taking medication and then things unravel. Not always, but sometimes they do. I'm sure Stephen Fry has gone on record as saying, potentially.
I think you're right. I think I've heard him say that. And it is very common in bipolar, as you say, to say that. And I think sometimes we fear neurodiversity. For people that don't have neurodiversity or people that don't have mental health, we're almost fearful of it, and we want people to conform to our society rather than embracing somebody else's abilities within that spectrum. In certain societies around the world, things like bipolar and schizophrenia are valued as having the third eye and the visionaries, whereas in our society, they're seen as something negative. And I think that's incredibly sad that we do that within a Western society, and we try to put everything in a box and make everybody the same. And imagine if we did that would make society so boring if we were all the same. And we should value the spontaneity of saying something out loud, because as you just described, Sam, comedians, that's what a comedian does. They get on stage and they're willing to put themselves out there to make us enjoy our evening at the risk of them bombing it and nobody laughing. So that takes a huge amount of courage to do that. And that courage comes from, in a lot of cases, ADHD.
Yeah. And I think that this is where it being in the public domain is starting to open people's thinking up to what ADHD actually is. 20 years ago when I started, it really was naughty boys. It was those boys who were bouncing around the classroom, couldn't possibly be girls, who daydreamed, couldn't be adults because you grew out of it. So the fact that actually our understanding of ADHD and thinking, actually, so part of what makes that comedian great is they've got an ADHD brain. Wow, okay. And that is part of them moving to see it as part of neurodiversity, just as we have biodiversity. It's fundamental. Rather than thinking, that comedian's great and funny and spontaneous, ADHD is somebody who's really disruptive and naughty in the classroom.
So why do you think there's I won't say backlash, but why do you think there's the negativity around it? Do you think it's lack of understanding, clearly? Do you think people are trying to use it as an excuse, probably, is what I'm beating around the bush to say? Do you think that's where it comes from?
Yeah, I think that's what really happens with ADHD. It gets labelled as that, doesn't it? And I think that's because each individual symptom is a very typical human experience. Oh, I'm so bored. Yeah, we're all bored. Oh, God, I missed my deadline for that. Yeah, me too. Or my house is a mess and I've got people coming around. Yeah, haven't we all? So if you look at each individual symptom, we can all identify with it and we can all resonate with it. And we can all give you lots of examples of when that kind of happened, which is different if we're thinking about bipolar or particularly psychosis. And I think even with kind of depression, people go, I get low in mood. But then when they've seen somebody clinically depressed, they go, oh no, that's different. Okay, all right, I'll believe in depression. Whereas because ADHD, each individual symptom, if you like, we've all experienced, and we've all experienced all of them at some point, but it's about then the persistentness of them and the consistency and how much they impair people, that's the bit of a conversation that people don't really want to hear, don't really want to listen to, and just go, you just want to get out of something. And I think that's probably where particularly ADHD really suffers with this current culture we're in, where people are wanting to name everything and people are wanting to understand something. And I do have to make it very akin to our understanding of trauma. A generation ago, or even 20 years ago, trauma was very particularly related to one specific incident. There were trauma services for that. We talked about trauma from if people have been in war zones or road traffic accidents, and that was it. Our understanding of trauma and how we define trauma has broadened hugely over the last 20 years, and that has had a massive impact on services. So now people talk about complex trauma, they talk about relational trauma, and actually it's everybody's business, because you can't have one team that deals with trauma, because it goes across so many people's lives in mental health. And so I think it's happening in other areas too, and it happens in ADHD, but people will feel much more able to go, oh yeah, we all get bored. They're not all going to go, yeah, we've all had trauma. So does that make sense?
Yeah, absolutely. I think, however, I'm going to say something controversial here because I like to. I actually think that we have got a society where ADHD is being used as an excuse and neurodiversity is being used as an excuse for people just can't be bothered and they go, oh, I've got ADHD. And they haven't got ADHD, but they're using that label because they've been informed, partially informed of the set of symptoms. They've gone, oh, that's what I've got. And I think that this is an absolute example of the decimation of mental health services within the NHS. If we had more SAMs who could see people in a timely manner and we could say, yes, you have, no, you haven't. And we just don't have enough of you, Sam, to be able to do that. So what we end up with is people being on very long waiting lists. And sadly, that makes people not even bother go for the waiting list. And a lot of people just go, I've got it. And that's going to be the reason why I'm going to use it to justify my behaviour rather than actually it being clinically relevant. And I think that's incredibly sad. And I think as a society, we need to invest more in mental health services to be able to, firstly, give the care to the people that do need it, but also to suppress the part of society which is wrongly using it as a label to excuse their antisocial behaviour and when it's not actually there, when it's not present.
I'm reminded there of where my husband works, a prison. Yeah. It's quite prevalent. And I've no doubt that it probably is diagnosable in that population, much more than the general population. But I think part of the problem, and I've seen this in the education system, is that you need the diagnosis to access certain services, be that benefits, be that certain sectors of education, or even under the Disability Act, certain provisions put in the workplace. And so in some ways, we've incentivized the need to get a diagnosis. I'm not saying that's right, but I can see how it's led up to the situation. And if you get an individual then who's never taken responsibility for anything in their entire life, it's just going to be another thing that is put forward as, well, I can't do it. That's my ADHD, in the same way that they, wouldn't take responsibility for the crime that they've committed.
Yeah.
And I think as well, it's difficult because again, we tend to focus on the people that we think are playing the system, that are using things as an excuse. And I think we often see them as a bigger part of a diagnosis or a framework than actually is the reality of it. There are far more people really struggling who have not got a diagnosis and aren't thinking about themselves in that way. And I'm thinking about, I don't know whether 10 years ago it was that people came to you as a GP and go, I've got back pain, I can't work. When is it actual back pain and it really needs treating? And when is it people using it as a way of getting out of work? There's always been those narratives about there's these certain people that just don't want to pull their weight in society or do something, and they're going to find an excuse, whether that excuse be back pain or whether it be ADHD or whether it be mental health. But I think the danger is the conversation ends up focusing too much on those people, and actually then it negates people's experience of actually really struggling. And the prison population, over 60% of those would meet the criteria for ADHD. It's huge. And you can understand, you start school. So let's say we're not even going to think about what their maybe family background and family history might be. You start school and from the age of 5, you're being told to be quiet, sit still, goodness me, where's your homework? Why have you not got your PE kit? It's always you, isn't it? And so things kind of start. So then you start thinking, I'm just going to disengage with school because they don't get me. They think I'm being a troublemaker, or in which case I'll be a troublemaker then. And then who are the kids that like you? The ones that like to see you get into trouble and want to know that, oh, I bet you can't climb up there, can you? I can do that. So you can see how the kind of story starts and why then they're much more likely to get into crime, because you find a group who actually want to exploit your ADHD and use your impulsivity and your kind of chaos to do the things they want you to do, and they end up being caught and they end up kind of committing crimes. It's engaging, it's exciting, it's really interesting, and where other people have turned their back on you because you're just too much, you're just too loud, you're just too busy. And so again, it's not about saying then ADHD is an excuse, but it's part of an explanation of where somebody has ended up or why they're doing what they're doing, and helping to make sense of that rather than thinking they just chose to be like that.
I think there is a part, when I say using it as an excuse, it's a bit like back pain. We see a lot of people with back pain who will say, I can't do this because I've got back pain. And I believe they do have back pain. I believe they're in pain. They're not telling me a lie. They're not saying, and they're going out the front door and doing roly-polies down the road. I think they're going out the door and hardly being able to walk to the car because they've got such intense pain. But I believe that actually they believe it to be something that it's not. And therefore, they are dealing with it in a way that is not helpful to them. And I think that is happening in mental health and neurodiversity, is that people truly believe they have ADHD, and they are using it as a reason for their behaviour, but therefore they're not getting the answer that's going to help them with their behaviour. Does that make sense? So it's not they're using it as an excuse, but they're using it as a truly held belief. That's what the reason is. And if we had more investment in mental health, we'd be able to say, no, this isn't ADHD. This is whatever it is, whether it be antisocial behaviour, and you need to understand more about yourself, and you need a life coach or whatever, or it's another diagnosis completely. And that might be a personality disorder, which needs a completely different treatment regime than a neurodiversity does. But it's that separation. It basically comes down to that there isn't the investment in mental health services. Yeah, and I believe we're still nowhere near being able to say we are a society that treats children with neurodiversity with the respect and care that they deserve. You're still seen as the naughty boy in the school, and you're still seen as the troublemaker, and you're still seen as the child that will climb the tree. And my son's in a specialist school for ADHD, and I'm incredibly lucky that he's there, and they're fantastic at that. There's only 100 kids in the school, and I describe it as an Al Qaeda training camp. These kids are either going to go on to be masters. Yeah, I'm going to. These kids are either going to go on to be terrorists or criminals, or hopefully the skill set is exactly the same as GCHQ, MI6, and world leaders in business. And the whole point of the school is to try and take them that way as opposed to this way. But I think in general society, we are still going this way. And that's why the prison population is overrepresented with people with neurodiversity, because we're not valuing those children and giving them the care and support they need as they go into adulthood, especially because we stop as children. Although we don't value it and treat it appropriately, we have that cutoff when they become an adult, and then we go, now you're really bad. And now the criminal justice system steps in and goes, have you?
Yeah, and I think it's also, for all those people who do have ADHD, it's understanding what ADHD is and what that helps them to understand and explain. And that's where, again, it's really difficult, very limited resources. So it's just this conveyor belt of assessment. You got it, off you go. And actually, that is just the beginning part of it. That's okay. So what does ADHD mean to you as an individual? How does that help to explain where you're at now? How does it help to explain the things that you are good at, which often people have completely lost sight of? But also, what does it help to explain? How is it part of understanding the things that you find difficult? And then how are we going to use that to help bring about change? So people think, ADHD is anger. Anger is not an ADHD symptom, but you can see why. If you have ADHD, you are more likely to get frustrated and experience difficulty, and then maybe that tips into kind of anger. But then it's about understanding that kind of formulation, I guess is the word that psychologists we would use, about how does ADHD help to explain where you're at and what you're struggling with, and then what are we going to do about managing that? And that's where strategies are really important, but it starts with people really engaging with that, really accepting who they are and their ADHD brain, and then working with it.
When you're an adult, you get ADHD. We don't get ADHD, so it's something you're going to catch. But when you have the diagnosis of ADHD, first of all, that must be a huge relief, because you reflect back at your life and you go,
yeah, now it makes sense.
Absolutely.
But when I look at Sean, who's my son, he goes to school, he gets play therapy, music therapy, OT, speech and language. He gets opportunity to have individual psychotherapy. He gets group sessions. All of these fantastic things do everything that you've just explained. But is that really available in adulthood? Obviously, I would say, I don't know, I'm asking you as the expert, I presume it's needed, but is that level of support there?
So it's interesting. So the NHS service I worked with, we were one of the very few in the country that had follow-up work for adults with ADHD, and it was an ADHD advice service, so giving people advice about the things they wanted to work on and support with. Increasingly, there is stuff online and people can access that. There are lots of fantastic ADHD podcasts and things which, again, people are getting into. And again, I think this is where you have comedians doing the podcast, you have ADHD, it's going to be more engaging for people. So there are resources that people will tap into themselves. Obviously, people go and see psychologists who specialise in ADHD. There are ADHD coaches. If you're in the world of work, then you are eligible to apply for access to work, which is almost the sort of adult equivalent funding of what you get if you're at university and you have a diagnosis of ADHD. And that funding, if you get it, gives you a certain amount of ADHD coaching sessions, but also if you need different sort of software for your computer, that kind of stuff. So there are some things out there. There's more things out there if you've got the money to pay for those things. But there are also increasing sort of free resources and stuff that people can tap into. But again, it relies on those organisational skills to think, how am I going to manage it? So often what happens is, and I think it's because people have gone, okay, great, I've got ADHD, right, what's the solution? Because ADHD people just want to move on, they want to get stuff sorted now. So they jump straight into strategies. Loads of books on strategies, aren't there, about habit formation or ADHD specific strategies, and think, right, brilliant, I'll try that. I'll try this notebook. I'll use this new system. I'll use this new app. And they use it and it works for 3 days, a couple of weeks maybe, and then it doesn't work. So then not only, now I know it's ADHD, and not only that, I've tried these ADHD strategies, they're not working for me. I'm even worse than I thought I was because I can't even use the ADHD strategies. But it's because the work that really needs to be done, which I'm guessing is really happening for your son at the school, is really understanding, what does ADHD mean to you? How does it really help you to think, where are my kind of frictions? Where are my kind of hurdles? What do I really struggle with? What don't I struggle with? How can I use that? How can I bring that in? And then when people really truly understand that, then you'll find the strategy that works for you. And you'll also, if it doesn't work, you'll think, okay, it's not worked. What is it about that strategy that didn't work for me? How do I need it to be different? And exercise is a huge area for that, where it's about, oh, I've tried all these different sports. Oh, I'm still paying for the gym membership that I joined 2 years ago. I've only been 3 times. I feel so embarrassed. Oh, well, exercise just isn't for me. And it's thinking, it's about really understanding what is it that works or doesn't work for you in an activity, and how do we harness that, and how do you need to do it moving forward.
So I think, going back to sport, obviously this is a podcast about use of exercise as well. I do feel that the clients that, when I'm working with clients that have got a diagnosis of ADHD, and I'm not an ADHD specialist in any respect, whether that be from a medical perspective or from a personal trainer perspective, but I do find that when I've got clients that are doing certain sessions and using those very high intensity sessions to almost occupy their body, allows their brain to be freer than if they're not doing something. So actually, I've got clients that will use the exercise part of the day to plan their day at that point because their body is occupied. I don't know if that's a...
Yeah, absolutely. Exercise can have so many benefits for people, or being out in nature, or just moving. So thinking about how do they use that in their ordinary everyday lives. A very sort of simple example is if you need to have a conversation with your partner about something, do it whilst you're on a walk. It's probably going to be much easier than if you're trying to sit and listen and you're thinking, just listen, and you're not listening because that's what you're focused on. Absolutely. But again, I think different people, different types of exercise work for. But again, it's them being curious, isn't it? Which it sounds like, as a trainer, that's a really fundamental part, and it's something you're doing about, why did that session not work so well for that person? What do we need to do differently? What was great about that session? And being curious rather than the client feeling shamed that they failed again and that it's just that they're not very good at exercise.
Yeah.
So it sounds like, given you coach a greater variety of activities, Stuart, that these people should seek you out for a coaching plan, whereas my more focused, I will just do strength training and get you very strong, would be less appropriate.
I disagree. I think yours would be just as good, but I think it's about, because it gives a structure, and they love the structure. And also the great thing I find about weight training is that every session can be made to be an achievement. And having a PB you can have a PB on a session, you can have a PB that you're aiming for, and having those short, medium and long-term goals really works with this group in society. So I think it's, as Sam says, it's about choosing the right platform for the person and embracing those skills. If you've got somebody who's likely to enjoy more extreme activities, if I'm with somebody who's skiing or snowboarding or climbing or mountain biking, that their clarity in being in that moment, whereas you and I are concentrating on not dying, they're doing something else in their mind that's able to be completely consumed by that, as well as do the sport.
And I think the other thing is, people really like that structure of being set a routine, Lynette. So actually they'll say, I go into the gym and I'm so overwhelmed by absolutely everything there is that my brain is constantly thinking about, could do this, could do that. And actually I just need to go in and do that thing that I've been told to do, and I will go in and I will do it. And then it might be thinking about, is it easier with headphones on or with headphones off? Is it easier if you go with a friend or you arrange to meet somebody after for a coffee? But that accountability, for ADHD, accountability is really important. And again, often people have reframed that as, well, I'm just obviously rubbish because I can't do it for myself. You need that accountability, you need that motivator, you need that kind of reason to have to do it. And mirroring, so whether it is about going with a friend and doing it with them, that can be really useful. So for some people, I've seen with ADHD, significant ADHD, have gone in and done the same routine and seen the progress and been able to stick with it brilliantly. For other people, the gym is an absolute no-no and they need that high adrenaline. So it's not treating everybody with ADHD as the same, but thinking, how does ADHD help to inform the challenges you have around sticking with exercise if you want to stick with it, or sticking to your kind of progress and things?
Although I'd argue that everybody should do that if they're wanting to make something part of their life, strength training, actually working out what motivates you, how best you are held accountable to yourself. There's an element of going through this with every client, but yeah, they're not throwing the baby out with the bathwater when the first thing doesn't work is probably a good point to bear in mind. Yeah,
absolutely. And also then helping people to think, how were you after that session? Because again, often people aren't reflecting. Generally, we don't reflect anyway. But if somebody has ADHD, did you notice, was your attention any better for the hour following it or the day following it? Or when's a good time to do exercise? How does that help you with your attentional abilities and what else you need to get done? Because if people can then recognise the importance of physical movement and activity in their life, rather than thinking, well, I'm just crap at concentrating, full stop, then actually there'll be times when that fluctuates, and exercise can be a really important part of improving that. So for some people with ADHD, a lot of people, they really struggle to go to sleep, and they're most productive in the late evening. So that's actually when they can get kind of chores done. So they don't want to go to bed at a good time because that's when they're most able to be productive. So that might be the worst time to do exercise, or it might be a good time to do exercise. So it's really thinking it through. And particularly if people are on medication, on a stimulant medication, when that wears off at the end of the day, for a lot of people, then if they go and do some exercise, that stops their kind of really hyperactivity from getting in the way of sleep. Although some people get really super focused on their activity and they get so wired by it, that affects their sleep. So again, it's thinking about it with the client about how does this knowledge of ADHD help to inform the best kind of practice for you.
That's really helpful. Yeah, that's very helpful. Very good. I've learned quite a lot, and I like to think I know a lot already, but every day is a school day.
That's been fantastic, Sam. I've really enjoyed that.
It's been really great. Good. Sam, would it be reasonable to put your contact details in the show notes if people were wondering about seeking a private assessment?
Yes, they'd be very welcome to. Yeah.
So we'll make your details available in the show notes. But I think that's really helpful, and I'm hoping people get some value from this, and people are welcome to sign up to the podcast Inner Circle if they want to ask questions. I'll put the link to join up in the show notes as well. And if people have got any comments that they want to feedback or share any insights, or if it's been useful or not, or any questions for the next episode, that's the best way of contacting us to do that.
Right. Fantastic. Thanks very much. Till next time. Thanks.